for violence and death are trans women of color. And what makes them at risk? What makes them at risk is being identifiably trans, and the opportunity to be blocked and not be identifiably trans. It's a conundrum, right? Because I don't have a desire to eradicate trans identities, but I do have a desire to keep people safe and protected. And if having the gift of selective disclosure does that, then I want to be able to give that gift to people. But we're not able to do that right now. There are many, many barriers to access, some which we understand and some which we have no idea about.
Right. And, I mean, I know for me and having that passing privilege because of testosterone, it makes my life a lot simpler. And I am not a trans woman either, you know. And I'm white, you know, and raised in suburbia, you know, and educated and have, even though I had just quit teaching, I had the good fortune to have bought a house and sold it, and that paid for my chest surgery, you know, and I worked a junky job during my transition period, so I didn't have to be in the classroom, you know, but it's that ability to be in the body in which you identify for at least, you know, the majority of your life, and I think about the fact that if you can't get on hormones and you know you want to be on hormones and blockers, but you can't, and then you've got all those years of depression and self-harm and alcoholism, addiction, being out on the streets because you're pushed out of your home because of lack of family acceptance. And actually that was one of the things we touched on at this summit, was that the majority of LGBT homeless youth, like 80%, are on the streets because of a lack of family acceptance.
Yeah.
And
that's still, this is still the case. What we don't understand, and we still need to gain so much information about this, is we have to dig deeper into what happens for young people at the onset of disclosure versus over time. So how can we as professionals get people in time to say, hey, is there any way we can keep this family together so you don't have such a hostile situation that a young person needs to leave and then the family kind of figures it out? You know what I mean? There's a lot of young people that come in and the initial reaction of their parents was really unsupportive and hostile, and then over time they start to understand, but sometimes it's not really, that living situation is not safe for a young person, emotionally or physically, and so they have to get away. And where can we do better as professionals to mitigate that? I don't think we have answers yet. We know that some of it is through education, right? It's education, but I'm still astonished by the numbers of people that come into my clinic, and they're still in that place of, oh, you're just going to do this for 2 years, and then you'll have a blocker in for 2 years, and then you're going to move on with, you know, being whatever gender that corresponds to your assigned sex at birth, and just a disbelief or a disconnect to the reality of someone's gender experience. It's still out there, despite the fact that there's been an enormous upswing in education visibility.
Right, absolutely. And one of the things we talked about yesterday was, I think, getting people from within those communities where there is such a lack of acceptance, people who do accept their children, to go and do the education and the acceptance education and bearing witness, you know, giving their testimony of you can love your queer or trans child. And just because, you know, you don't have to worry about everybody judging you, because many of us have been in your shoes, but not to have it come from the typical, you know, other people coming from the outside in and talking about acceptance and telling you to change your beliefs. And so I totally agree there.
Exactly. I think we learn.
Go ahead.
We take this lesson from. We're still struggling. Certainly, young African American men are still at just extraordinary risk for HIV acquisition, and this idea of, how best to, this is still a tremendous challenge, right? It's how best to help the community accept and understand that, LGBTQI folks are not limited to white populations, right? So this is a human experience that happens across all, communities. And I don't think we're even there yet with, young gay black men. We're still struggling in this area. And I really think for trans experiences, it's an additional challenge. I think it really is. And you're absolutely right. I mean, the strategy is not for a bunch of white professionals to go into those communities and say, hey, this is what you should do. That's not the strategy at all. It's to try and find exactly what you're saying, young people and parents alike from the community to go in and have this discourse in the spaces where people feel the most comfortable having this kind of conversation.
Yes. Aydin, what's ringing up for you?
A lot. There's a couple of things that, sort of your initial question about Joe's process or decision to be out or open as a provider of this care. That conversation happened a few minutes ago, but there was something that I was thinking about that I thought would be beneficial to share is, as a trans man and provider, so a service user and a service provider is a lens that is very different than I think cis folks who are providing services or trans folks who are just receiving services, right? So that overlaps with personal and professional, very much impacting guides my work. But specifically to the question you asked, Joe, that there are many, many times and spaces that I have to negotiate and navigate how much do I disclose about what I do professionally, because similar to you, Christian, that I have the ability to be non-disclosed.
Right.
And for a variety of different factors that you listed of, I'm tall and I'm white and I have, some of the characteristics that one would assume to be that of a cisgender person and often assume to not be that of a trans person. And so we'll be places, in these random places, and people will strike up conversations and, do that inquiry of like, oh, what do you do? And Joe will say, oh, I'm a pediatrician. And they're like, oh, make some sort of comment. And then almost always Joe will say, well, my entire practice is actually working with gender nonconforming and trans youth. That's all the care that I do. And then I will be in a similar situation either with or without her. And despite being very open and very out, speaking nationally about the importance of advocacy and education around trans youth and gender nonconforming youth, it is a rare occasion that I will say what I do. And that's not about, not being proud of it. It's not about any of those things. But I think as a trans person, it's different, or at least it feels different to negotiate and navigate talking about, my entire career, my entire practice with trans folks is different than a cisgender person saying, oh, my entire practice, my entire career is working with trans folks. So both being activists and educators and service providers, it's interesting on a personal level how we both show up to that differently, and the perceived consequences or things that I'm going to physically have to deal with or answer, because they're not going to know that I'm trans unless I tell them. So I'm going to look like, at face value, what I'm going to look like is a straight, white, cisgender man working with trans folks. And how on earth am I going to explain how I came to that work? Because that's the next question people ask. Oh, how'd you get into that?
And you don't want to lie. And you don't want to lie.
And I have no issue with being out. I have no issue with saying, in most situations, in a certain sense, oh, I'm trans. But I'm not interested in actually having that conversation with the person in front of us.
With every person.
Right? I'm not interested in having that entire conversation everywhere.
Right, and even if you've never been homeless, it doesn't mean you don't help the homeless.
Right. 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 So it's interesting that the thought process of, you know, how did we come to this work? How do we talk about this work? Where do we talk about this work? And what's the trickle down, or what's the perceived or actual emotional and sort of psychological ripple effect when you're talking about your work and people's responses? Because when somebody says to me, oh, those people must be so difficult, that lands differently as a trans person than I think that it lands for a non-trans person. And so I just sort of was thinking as you asked that question that, you know, I'm very out as a trans provider, and then there's the day-to-day reality of my life where I'm like, can I just have my coffee?
Yes. Right, you just want to go to the grocery store sometimes, right? And you have the visibility where you want the visibility. And I think that's important for all of us.
Yeah.
You know, like whether you're gay or straight or whatever, right?
And then for me, there's the navigating the ripple effect of shame, the ripple effect of like, you know, gosh, I didn't say something. Where was I at the last time? Oh, I was at the store the other day. I was buying clothes in preparation of this trip to Amsterdam. And first of all, I should just openly disclose, I don't like small talk. I'm kind of an introvert. I'm pretty shy. And so Joe's laughing. You can't really hear her. She's on mute. But it's true. Like small talk. Like I think I would rather, like, I don't know, I'd rather do a lot of things than small talk. So,
small talk. Yeah.
Yeah. So I'm at the store and I'm buying these clothes, and he's trying to talk to me, and he's like, oh, you know, are you working today? And I was like, well, I'm actually in your store shopping right now. And he said, oh, you know, well, what are you doing? I'm like, I'm a therapist. Well, what kind of therapist? I was like, I'm a mental health provider. Oh, there must be so many people in Los Angeles because we're all so blah, 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 blah. And in my head, I'm like, I know where this conversation's going. Like, I know, and I'm at this crossroads of, do I want to be standing in this specific store in Santa Monica, California, having this conversation with a 21-year-old who's making all sorts of assumptions about what it means to be a therapist, and probably further assumptions about what it would mean to be me working with trans people. And I'm like, in my head, I'm like, can I just buy my pants? I would love to just be able to buy my pants right now. Right?
Right.
But then leaving that store and feeling very guilty and very ashamed that I didn't put a voice to an experience of people whose voices will never be heard or counted or validated. So I have my own residual baggage and feeling about participating in the silence of this experience. So it's tough.
Yep. It's an awful space.
Yeah.
And I remember Aydin Cait when I first started transition, and Aydin was one of the first people I met. And he really, you know, big brothered me. And I called him one day and I said, Aydin, are the gender days ever going to go away? He said, nope.
No.
And I said, okay, I can deal with that. But that when do you, like, even now, it's, I think about as parents of trans youth, when do we disclose? When do we not? Oh, so they were so-and-so and now they're so-and-so. Oh, that must be so challenging, accepting that. And they don't know that I'm trans, or, you know, it's like, I feel for parents of trans youth as well, who are assumed, right, to be this heteronormative, parents of gay youth, whatever, that they're assumed to be like-minded with these people who don't get it or don't accept it. And then it's up to them to either disclose or not disclose. And what that person, do they have a right to know who you are?
Right. I think one of the things that
and maybe you go back next time, right? Sometimes you just want to buy the pants and you send them an email. Or, you know, send them your YouTube videos.
Right. I think that what I've spent a lot of time both speaking about personally and but also talking about professionally, you know, especially with parents, but also with my clients directly, is this, I think it's inaccurate and it's a misnomer